Dengue Fever by Romana Campagnotto and Gabe Marina.
Dengue virus, or DENV, is a pathogen that is caused by a virus of the Flaviviridae family, Flavivirus genus, which includes viruses such as yellow fever, West Nile, and tick-borne encephalitis. The dengue virus has 4 strands called dengue 1 through 4. These 4 distinct dengue viruses do not allow for cross-immunity, which means people can have up to 4 dengue infections in their lifetime.
The dengue virus lives inside a host, its preferred hosts being the Aedes aegypti and the Aedes albopictus mosquitoes. DENV permissive cells include keratinocytes, dendritic cells, endothelial cells, fibroblasts, macrophage, and mast cells.
The initial infection occurs once an infected mosquito bites a human and the virus is injected into the bloodstream of the individual. Dengue virus can occur in people of any age and is more likely to occur in a person who has recently traveled to affected areas, which include areas in the tropics or areas with tropical climates. Prior illness does allow for the body to create antibodies, but because there are 4 known strains of dengue virus, a person can contract dengue fever 4 times in a lifetime. Symptoms: sudden high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, fatigue, nausea, vomiting, skin rash which appears 2 to 5 days after onset of fever, mild bleeding, such as nosebleed, bleeding gums, and easy bruising.
What cells get infected? The virus enters through a mosquito bite and infects nearby skin cells called keratinocytes, the most common cell type in the skin. The dengue virus then also infects and replicates inside a specialized immune cell located in the skin called Langerhans cell, which detects invading pathogens. Thankfully, this disease cannot be spread from person to person. How does the pathogen cause symptoms of this disease? Fever, caused by the infection of dengue into the body. The fever increases the amount of antiviral in the blood. Headache. Headaches are the result of dengue causing overactivity of, or problems with, structures in the head that are pain sensitive. Rash. A rash is caused by inflammation from dengue spreading into the skin cells. How does cell damage, tissue damage, organ damage, or death occur? When dengue enters the body, it bypasses the immune system by riding the Langerhans cell, which takes it to the lymph nodes and infecting monocytes and macrophages, which are in charge of ingesting and destroying the pathogen. From there, it spreads to the other cells, including those in the lymph nodes and bone marrow, macrophages in both the spleen and liver, and monocytes in the blood. Dengue rarely causes death. However, the infection can evolve into dengue hemorrhagic fever, which causes frequent vomiting, bleeding under the skin, and abdominal pain.
How are individuals diagnosed with dengue fever? Common signs and symptoms of dengue fever include high fever, pain behind the eyes and in the joints, muscles, and/or bones, severe headache, rash over most of the body, mild bleeding from the nose or gums, and bruising usually. Dengue fever used to be called break bone fever, which might give you an idea of the severe bone and muscle pain it sometimes can cause. The fever isn't actually breaking any bones, but it can sometimes feel like it is.
Treatment. There is no specific treatment available for dengue fever, but mild cases are managed with lots of fluids to prevent dehydration and getting plenty of rest. However, to treat severe cases of dengue fever at the hospital, doctors will give intravenous fluids and electrolytes to replace those lost through vomiting or diarrhea. When started early, this is usually enough to effectively treat the disease. In more advanced cases, doctors may have to do a blood transfusion. Most cases of dengue fever go away within a week or 2 and won't cause any lasting problems.
You're fine.
Okay, I don't really care.